Sadolo, the leader of the delegation representing the Honorable Minister of Information and Supervising Minister for Defense, the Director of the project who's coordinating the visit, commissioners, senior special advisors, senior special assistants, permanent secretaries, and the press. I welcome you to our last stop for today. Well, it's actually the last stop if you don't want dinner. But if you want dinner, then this is our last but one stop. This is a bit strategic for us because this is one of the priorities of WADA administration to make Kogi a very strong base for transformation agenda. We have four major areas as priorities. They are good governance, human resource development, including education and health, agriculture, and infrastructure. Here we have two in one, the infrastructure and health, or in health. We have here the Diagnostic Center and the Specialist Hospital. Kogi State maintains the Specialist Hospital 100%. And I will hand over to the Commissioner for Health, Dr. Idris Omede, to take us through. But one thing you must bear in mind, and I'm so pleased that all of you are still very, very strong. Haven't left Abuja very early in the morning. It appears that many of you can go on till tomorrow morning, non-stop. But we are very prepared, and we hope that you all been energized, so nobody's going to fall sick here, even though the hospital is just next door. So let me pass this on to the Honorable Commissioner.
Thank you. The representative of the Minister of Health on the Good Governance Store. Minister of Information. That is my territory. I am Dr. Omede Idris, Commissioner of Health, Kogi State, and I welcome you to this site. Adjacent to you on your right side is the Specialist Hospital, Kogi State Specialist Hospital. And this structure that has been put up here is a modern diagnostic, imaging, and comprehensive laboratory services center for the state. As the name does suggest, modern diagnostic imaging, it is going to provide a battery of investigations for people within the state and outside the state when it is completed. We felt we should bring you to this site, just like the Secretary of State government say, to showcase one of the things that this government prides in, providing health for people. And while this is ongoing, it's important to let you know that part of the diagnostic things that are going to be here will be a women imaging center where we'll take care of obstetric and gynecological investigations, including mammography for breast cancer. We're going to have a computerized radiological unit here for all batteries of investigation that are required for x-rays in this center. Not why I say computerized, it's important to differentiate that because you have normal x-rays that you have to wash, you dip and bring out. This one, the computers are there, you are seeing it, you are just printing, and you can't make mistakes about it. This center is to have a computerized either tomography, CT scan, and magnetic resonance imaging in this center. You know, these are investigative procedure, pathology, and microbiology, just call it hematology. All these are very the papers and get this thing back into our country. So we believe very well by the middle of next year we should be able to get this thing completed. Thank you.
Yes. I know you are tired because I could not see so hands on the writing part. So that is a sign that my member answer. Well, question time. Yes. My name is Kola Tului. I want to observe all the protocols already. Yeah, Kogi Affairs. I publish Kogi Affairs. And I want to stand on the existing protocol. I want to stand on the existing protocol, please. I think it was just a matter of oversight that he didn't mention the cost of the project? Maybe because it's still ongoing, but I'm sure you have something on the budget that you want to tell us what it's going to cost. Just a rough estimate. Thank you.
With regards to the first question, the contract sum both for the construction and the equipping of this hospital of this diagnostic center is 1.8 billion. 1.8 billion. Then with regards to, and as regards completion time, it's a factor of availability of fund. If the fund is available, I'm sure we'll jack this thing. Maybe by February next year, you'll see that everything is true. Now, with regards to, actually the concept of it is informed by the fact a jam point between the north and the south. You must have seen the kind of traffic you are seeing on this way. And we know the kind of problems our patients have both in this hospital and the Federal Medical Center in terms of diagnosis or problems that they have. This traffic is so massive, and we foresee it even increasing because Lokoja, as far as I'm concerned, is going to be a tourist attraction city. And if that does happen, then definitely there's going to be volume of activities and the issues that can be handled within this vicinity. Sometimes the movement causes more problem to patients than the problem they originally have. And so if you have this kind of center, it will actually reduce the incidences of mortalities and some of these problems that these machines are going to be diagnosing. So we are wary of that, as that is actually put into consideration in conceiving this project. And for purposes of functionality, the government is taking the bull by the horn to finish this project. But once it's completed, it's going to be operated on a public-private partner basis for purposes of sustainability and maintenance of the delicate equipment that are going to be here.
Another one? Just one question, man. Okay, two more.
This question. If they are diagnosed, what happens? First and foremost, the diagnosis of patients that are going to be here will not be from our own hospitals alone. Once these services are available, neighboring states can even send their own patients here, just like we send to other places now to do. So it is going to serve not only Kogi state, but as many states as want to make use of this place, most likely the neighboring states in this area. If it's for us here, once the diagnosis is made, does not mean that we'll be able to treat it. If there's something that cannot be treated, you look for the appropriate office personnel, specialists, wherever he is, and make inquiries with him, and whether he can come over, and if, in terms of whether the person can come over to handle the case, or you refer the person. But before you refer, you have already seen the case, and then you now know how to manage that person for purpose of referral, so that his condition does not get worse on the way. That is with that. With regards to women in rural areas, for all you can know, in all our local government, we have our own general hospitals there. This is, for all intent and purposes, it's a tertiary institution. It's not an institution for simple cases of normal delivery, normal pregnancy, and things like that. It is highly a specialized kind of thing. It's tertiary, so to say. And in addition to what I've said, Kogi State has already started College of Medicine University, and the teaching hospital is going to be adjacent to that university there. The students can even come here to look at some of these machines that are here, which are part of the thing they're supposed to use in their training, in their training. So we are rendering services to our people in our rural areas, and it may be interesting to know that Kogi State carries out what we call quarterly free rural medical services for all our populace in the state. This is just a stopgap that the state government is doing to catch up with the health needs of the people, pending when we fix most of our health facilities to render their regular routine services. And for now, if you ask co-guides, they will tell you that the free rural medical services has done a lot of good to them, and it is done purely sponsored by local government with corporations of the local government.
The question about excuse me, sorry, I'm not getting tired. It's just I need to take some more water. No, I'm not. I mean, this is actually money time for us in the course of the Good Governance Store. The SSG has been pressing us by indirection, for us to go and take a meal and sleep off. SSG, I would like to assure you that if you are going to have this team run the rest of the night, will be available. Yes, will be available. I thought the more direct question, but which was asked indirectly and which the Honorable Commissioner for Health also answered, has to do with the healthcare program of Kogi State, because obviously this is this is a tertiary infrastructure. But he has explained it, what they try to do, and so on and so forth. Perhaps if we have the opportunity again, you could pose a question to him so that you have a clearer picture of the healthcare program of Kogi State and how the people are benefiting, and if there are also statistics as to common ailments, which probably had fatalities in the past. What are the new statistics that you have with regard to the outcome of the intervention by the state government? But over and above that, I would like to exhort the Kogi State government that what they have embarked upon here is a project that they should also finish on schedule and ensure that the rigorous standards that they have set for themselves are actually realized. Incidentally, in the course of our tour, we have seen similar projects of this nature. Next door in Kwara, I'm sure those of us who were in Ilorin will recall that Kwara had completed and in fact furnished its own diagnostic center. Some other teaching hospitals, some other states that we went to, we also saw in Guzo, for instance, one of the cancer screening centers, the Federal Medical Center. So the evidence that we have again before us is that there is growing intervention by both the federal and state governments in healthcare delivery. And where we are now is evidence of what the Kogi State government is attempting to do. I say this against the background of, again, the common expression that you hear, growing our capacity to take care of our people when they fall sick or when they are ill. And diagnosis, as the Honorable Commissioner for Health has indicated, is a primary step, it's a cardinal step in medical treatment. Gone are the days when if you had a headache or you felt some signs of fever, they were prescribing Panadol and anti-malaria drugs for you. But the proper investigation is a prelude also to good Shopee financing arrangement. Not much work was going on that particular road project. And currently, we are told the percentages at the various lots, and hopefully the work will proceed at pace, and the motoring public will have a good deal to cheer about once the job is completed. So that was a heartwarming project that we saw on our way. We also, of course, stopped by at the Jamata River Port. Again, a very impressive project that speaks to an effort by the federal government to improve the infrastructure for marine transportation. The Jamata River Port project is a useful complement to the capital and maintenance dredging of the Lower River Niger. The Lower River Niger had been dredged from Barrow up to Warri, and the number of port projects are underway along that particular corridor. Onitsha Port has been completed and commissioned. The President did that. It's awaiting concessioning. And the Jamata project is one amongst others that will be on the way. The other being, of course, Barrow. Thereafter, we stopped by at some state projects. We saw the soya bean project by the Kogi State government. We also saw the Arise project. Again, those projects speak to the determination of the Kogi State government to make agriculture useful as a source of employment, as a source of income, and as a source of self-sufficiency for Nigeria in the course of seeking to generate the appropriate foodstuff that we should have. But particularly, the Kogi example, in my own opinion, speaks to the cooperation and collaboration between the federal government and the state government. Here, we're speaking of cooperative federalism. Again, it's a clear reminder that the federal government is working assiduously, and the Kogi into Lokoja itself. We've seen the wow projects that you will take away without question. We are at the stadium, and one of our colleagues, of course, remarked that the stadium being built by the state government would beat in quality and standard what we have seen here in Lokoja. A beautiful stadium, a lovely edifice, and happily a number of high-profile matches have taken place there. We also urge the Kogi State government to ensure that maintenance, which has always been a bane for us, on several projects, maintenance doesn't then become the handicap going forward. We stopped by at the new Federal High Court complex. Federal High Court complex, I explained in the course of our briefing there, at the Federal High Court complex, the new structure is related, obviously, to the transformation agenda on two fronts. One is governance, the other is infrastructure. Infrastructure being the building that you are seeing, the digital facilities that are in there in court, but more importantly, the reform of the judiciary to ensure greater efficiency. Because if you have a good work environment, obviously, your rate of productivity will be much higher. When we were there, some of our colleagues probably omitted to find out the jurisdiction of the Federal High Court. The Federal High Court is a very busy court, as you very well know. It handles a number of cases, more particularly between a plaintiff or a complainant and federal agencies. It also handles matters pertaining to economy, customs, and so on and so forth. So it's a very important project. And here we have stopped by now at the Diagnostic Center. Add this to the new State Secretariat, Phase 2, Kogi State Government having relied all along while they were still a baby on the benevolence of the federal government, who provided the first phase of the Secretariat. Now that they have become grown-ups and adults, they have their new Secretariat, and hopefully they will move in there shortly and also accommodate in the old wing the establishments of the federal government that are here. So day one, I think that I will leave the opinions to you as reporters, but obviously we have seen projects, and the long delay in visiting Kogi is paying off handsomely. And as you can also see, there is nothing to indicate that any of these projects have been rushed up for us to see. Thank you.
I want to formally thank all of you for your commitment, your persistence, your understanding, your exceptional consideration for what we have to offer today. You will all agree with me that going through 12 projects in a day is a long list of chores for the day. But I'm so impressed that you have stood by us all through, and you have shown your worth and your commitment in looking through all the projects. The Special Advisor on Media to the Minister has said it all. I just want to underscore the fact that going through 13 projects today for both the federal and the state government